Cool. Well, if you all can hear me, we can go ahead and get started. Thank you so much for being here as we celebrate National Minority Health Month. My name is Keegan, and I'm the Wellness and Wellbeing Coordinator for the National AABNP chapter. We have a very special discussion planned for this afternoon, led by our guests, Chandrika Milner, Urmi Chakrabarti, and Aliya Ismail. From Toronto to Lima, Miami, and now St. Kitts and Nevis, is it pronounced? Aliya Ismail is has been working on therapeutically has been working therapeutically in community mental health and educational settings with youth, families, and college students. She is coincidentally part of the vet med world, serving as the director of university mental health services at Ross University School of Veterinary Medicine. As a licensed mental health counselor and certified clinical trauma professional, she strives to work with her clients from an anti-oppressive and informed framework. With an additional background in international development, Aliya considers the impacts of global dynamics on the overall health of individuals and communities. Aliya is excited that we are all connecting today in our shared Asian identities. Aliya's ancestry is from India. Her parents were born and raised in East Africa, and Aliya was born in Canada. She wishes, and you'll have to help me with this pronunciation, Eid Mubarak to
Eid
those who are
Mubarak.
celebrating.
Yeah.
Thank you so much. I appreciate that. Dr. Chandrika Milner uses she, her pronouns as an associate professor in the Department of Psychology and Applied Therapies at Lesley University and part-time faculty at Boston College. Her overall professional approach is grounded in anti-colonial frameworks. Dr. Milner's research focuses on work and wellness for marginalized and minoritized communities, including individuals with psychiatric disabilities and Asian Americans. She is also a clinician currently in private practice with many years of experience in community mental health care settings. Urmi Chakrabarti, who uses she, her pronouns, has 15 plus years of experience in the behavioral health and wellness field in different capacities, such as therapist, activist, educator, workforce developer, and public health professional. Her practice is strength-based, trauma-enforced, and client-centered. She draws from modalities based on both Eastern and Western philosophies from a systemic lens. Aliya, Urmi, thank you so much for sharing your time and expertise with us. We so much appreciate it. We're so excited to have you, and the floor is yours whenever you're ready.
Thank you, Keegan, for that gracious introduction. And I'm so excited that you came across our paper, Keegan. This is how it all started. Keegan actually came across our paper that we published in 2021, Decolonization of Asian American Mental Health. And whose slides are we going through? So if someone can go to the agenda, I forgot who's in charge of the slides. Okay, thank you. So today we're just going to kind of touch upon the concepts of decolonization, how we framed it in our paper, understanding the Asian American diaspora, mental health practices as colonial tools, therapy as a neo-colonial tool, and really then try to see how we can discuss this and how this impacts you and any questions you might have. So with that being said, so I wanted to go further into so, before we even get started, how do we even conceptualize decolonization? So if we can go to the next slide. So I'm gonna, since there's two of you, just feel free to share aloud or in the chat box what any word that comes to mind when you look at the term decolonization. And you can put it in the chat box, or you can even introduce yourself aloud so we know it's just the two of you. And then I see there's Krista Lamb that just joined as well.
There's a few more.
Few more. Oh, okay. So yeah, so feel free to introduce yourselves through the chat and one word that comes to mind when you hear the word decolonization. So there's unlearning, becoming independent of a colonizing country.
I think some others were freedom and liberation.
Freedoms and liberation. Okay, thank you, because I'm just having a hard time scrolling. Okay.
Mm-hmm.
Anything else? Okay, so there's Krista and a few more. Keegan, thank you. Okay, Ori, nice to meet you too. Yeah, so just to give a premise about how we conceptualize it in our paper, really pulling from a lot of what you guys shared, was to really look at how we could deconstruct some of the foundational premises of colonial European belief systems and how they impact mental health practices today. And with that, really identifying colonial structures of domination that usually favors cis straight white men who are able-bodied, and really informed global systems of oppression, and other people who were not that, and specifically looked at how colonization of Asia led to the erasure and fragmentation of Asian cultural values and practices that were at times seen as backwards, and then later on kind of appropriated in Western psychology without appropriate recognition of their origin or concepts. And so forth. So we can go on to the next slide and really also incorporated stuff that we looked at, how we could incorporate liberation and concepts of how we continue to be impacted by the socio-political aspects of that history. So the next slide is trying to look at the Asian diaspora, what we mean by that. So as you know, we all check different boxes that identify as racial, us racially in different official documents. What we wanted to mainly note was these categories were created from immigration policies and socio-political trends in immigration policies, as well as colonial hierarchies of race that were globally impacted. So we also wanted to note that even borders in Asia and Africa were created based around land grabbing and occupation, and not in a way that really aligns with how people identify. Many ethnic groups were split up and can sometimes identify with their people across the border more than some people within their borders. In the US, there's also an assumption that Asian only refers to people of East Asian descent, when most of us know that this racial group can include people from Iran to Sri Lanka to Fiji Islands. The Asian American racial group in the US is one of the most all-encompassing racial groups that includes the widest range of ethnicities and cultures because of this reductive attitude towards ethnicity and culture. So given this, these challenges, how this group is categorized, we note that the term Asian American was coined by well-known historian and civil rights activist Yuji Ichioka. And we use it to include all individuals who self-identify as Asian. So with that, Uma can look at mental health practices as colonial tools.
Yeah, thank you, Urmi. And I guess I control these slides, so I can't demand somebody else do that. Well, it's all good to see you all, and thank you for joining. Thank you, Urmi, for the transition. So I'm going to add a little bit to Urmi's definition of colonialism. So there are all these kinds of terms you'll hear when you talk, kind of delve into the literature on decolonizing. There's anti-colonial, decolonization, decolonialism. There's all kinds of terms, but in this context, we're really thinking of occupation of land and kind of stealing of resources, right? Leaving countries and spaces impoverished, and even the countries who were not directly colonized, there were all kinds of pressures that those countries experienced as a result of colonization, which resulted in a lot of conflict. And particularly when we think of colonization, we think of the divide and rule policies, right? Which created kind of almost insidiously fueled the intergroup conflicts and exacerbated them to create a lot of divisions that we even experience today between communities. There was a lot of subjugation of indigenous people and imposition of these hierarchies of European and Western norms being better. That's what we're trying to kind of do in our paper too, and in the work that we do, is to recognize that there are these hierarchies, and that process of oppression, not just as a system that communicates that people are inferior, but it also inculcates within the human psyche of indigenous communities that they are inferior, and those are very, very long lasting. So those are kind of harder to work with, right? Because that's what people internalize. And some of the current, and you'll see this in the recent waves with COVID-19, a lot of what has happened with anti-Asian racism, it's just a simple, like it's a flashpoint in our history of racism. Anti-Asian racism has existed for centuries now. And some of the kind of the terminology will probably ring true. One is the model minority myth, that is about people being, the Asians being the model minority, and then the simultaneous perpetual outsider stereotype, which has to do with, even though you're considered this model minority, you're always on the outside, right? You're never one of us. So this kind of seesawing between exoticizing and then condemning, and being making people feel inferior. So all of that permeates, and I will hear more about it in the context of neocolonialism in Aliya's section, but I just wanted to give you that framework because that directly leads into how mental health as it's currently practiced, and we're all in psychology, we're psychology professionals. The theories and the systems of psychology were built at a time when these hierarchies were very, very clear and set up in a way that really saw all groups of indigenous communities, and also anyone who wasn't European, as being inferior. So which was basically determined based on European American individuals. These theorists, like psychoanalytic theorists, would base their conceptualizations on inferiority of Black indigenous communities. And we know that indigenous children were removed from their homes in the United States because their culture was seen as backwards or primitive, right? So to educate and to improve conditions. So that was very much the conduct of colonization. And in psychology, psychiatric institutions were built in Europe, institutionalization was the standard for anyone who was different. So people who were struggling in poverty, there were institutions for everybody. Psychiatric institutions were one of those, and they became, over the course of time, these kind of correctional facilities for anyone who didn't meet the norm. So immigrants, for example, particularly Chinese immigrants in Canada, there's records of how they were incarcerated in psychiatric facilities for speaking out, or what is, quote, this conspicuous incidents of violence or longstanding conflicts with the surrounding community. So it was very loosely defined, and there was this tendency to abuse with sedatives, restraints, mechanical restraints, and even isolation. So just to, give you a perspective, so even psychopharmacology, the medical field, which is a standard part of treatment right now, it's, based in neocolonial principles and focus so much more on profit than healing, which we think of as a neocolonial value. But what happened as a part of this is that, Asian Americans have been thought of as having, and this is the standard, sort of the narrative around Asian mental health, that Asian Americans, this is like a stereotype, that Asian Americans don't understand mental health. They don't, there's a stigma of mental health, and they tend not to go for therapy services. And it's attributed to Asian Americans having greater stigma of mental illness and lacking an understanding or education around it. What is not talked about, it's never contextualized within the trauma of psychiatric institutions that were placed in colonized countries all across the world. There's very little conversation on the erasure of these traditional practices, which are currently being used, like yoga, mindfulness, etc. They're considered as, primitive or unscientific at the time when, these lands were colonized, but now it's being integrated into psychology without contextualizing those, or even recognizing that those are important elements, and they're part of systems that contribute to the overall mental health of Asian communities. So that's just to give you a little bit of perspective. Let me see if I can get to the next slide here. So I just wanted to give you an example of this. So I have two diagrams. This is in our paper as well. In the diagram that's on my left, and I think it's on your left too, you see there's this Venn diagram of the mind, body, and spirit. This is almost the conceptualization that a lot of, in sort of white European thinking, this is what is very, very prevalent, that we have to separate out the mind, body, and the spirit in order to understand them in depth. And so everything is based on really kind of thinking about, okay, the body, and like looking at the body as a discrete entity and kind of thinking of all that goes into the body. The mind as a separate entity. So in psychology, we really focus on the mind. It's only now and recently that we've been looking at holistic approaches. But in almost all indigenous communities across the world, this understanding really doesn't hold. Most people view the mind and the body as part of a larger whole, which is the spirit. And it's referred to as using different terms. But particularly in Asian cultures, this is very prevalent. So to make these discrete kind of entities is, it doesn't quite match the conceptualization that exists in Asian cultures. And that's this mismatch too that occurs between how we provide services and how we think of the mind and what is actually how people conceptualize this holism, the interconnectedness. I'm sorry, that's my son. And so, even in psychology, there's this thought about the spirit as being, associated with religion, and therefore we don't touch it because it's not scientific, right? But that's not how most of the world operates. So that's just to give you an example. I'm sorry, I didn't mean to stop sharing. I'm sorry about that. I'll hand it over to Aliya from here. Thanks.
Oh, yes, this was kind of, this was the next slide. So knowing what we know, I just wanted to do a broad overview of what we presented in our paper, how we start to kind of reframe how we practice with people who identify as Asian. And we so how do we apply this in practice? In our paper, we looked at how we can use post-colonial inquiry, such as concepts from, and some of this might seem, and you can ask questions later too, from liberation psychology, concepts from liberation psychology, intersectionality theory, queer theory, and to look at how therapists can question their positionality, biases, and apply critical consciousness to include the history and context of colonization into their work, making space then to respond to the cultural mistrust, dissonance, and not pathologizing it or labeling it as stigma or resistance, which is usually what some people experience in the mental health field. And then really acknowledging the current systems of oppression that are internalized and deeply rooted in colonization. So that's kind of how we're looking at deconstructing some of these mental health practices. And the reconstruction piece in the Asian-centric framework that we proposed was to really elevate the healing practices and potential of the collective that our clients are from, that have been erased or deemed inaccessible or lesser than due to colonization and continued neocolonial biases, which Aliya will touch upon, to further contextualize mental health stigma, help-seeking pathways, psychological fragmentation, and distress. So we can go to the next slide.
Okay, so Uma and Urmi have set the stage around how mental health practices have been used historically, and this has set the stage for how mental health practices are currently being used as a neocolonial tool. So what is neocolonialism? This is a term that was coined by Kwame Nkrumah, who is a politician and revolutionary from Ghana. And it's essentially what we call modern forms of exploitation that are more insidious than what was historically done. And it's exploitation typically by the global north of the global south. So what does this look like in Asia? It looks like Western countries economically exploiting Asian countries through unequal trade agreements. We know a lot about sweatshops and exploiting labor from Asian countries, creating multinational corporations within these countries, and then displacing people that live in those areas, displacing local businesses, polluting the lands of people in Asian countries. It includes oppressive foreign policies that destabilize governments and then blame those countries for their instability and their poverty. Neocolonialism also includes Orientalism. It includes fetishizing Asian cultures and Asian people. We see that especially through tourism these days and sex tourism within many different Asian countries. And we also see neocolonialism through the commodification of Eastern traditions, spiritual traditions, religious traditions. So if we go to the next slide, thank you, Uma. These traditions include very trending, popular practices such as yoga, meditation, mindfulness, breathing, and a lot of these practices have been incorporated into very widely used therapeutic modalities. So if you've been in therapy, some of these have probably been used with you, these interventions or these modalities, and I've used some of them myself. And they've been used without being given any credit. And these traditions come from very rich historical contexts. So spiritual contexts, philosophical, ethical contexts, and the way that they've been appropriated in, just the popular world or even in mental health has been for very individualistic purposes. A lot of these practices are done in congregation traditionally. They're done for the greater good. They're done perhaps with an intention to connect with other people, connect with a higher power. And the way that they're used right now is very individualistic. They're used to make money. They're used for profit. as Uma also mentioned. So I'm going to give you an example of what this looks like in our daily lives, and especially if we're going into therapy. So let's imagine, hypothetically, I'm a vet med student, and my family has migrated to the US, and I know bits and pieces about their migration history. I know my grandparents and my great-grandparents perhaps went through a lot of loss. They don't talk about it that much. I think that there was some violence and, national violence, international violence that they lived through. I know that they suffered a lot, but we don't talk about it too much. My family does practice traditional Chinese medicine, hypothetically, and I see bits and pieces of it. My grandmother, she does breathing exercises in the backyard. I see her practicing Tai Chi. We don't talk about it too much, but I've noticed that growing up. And right now I'm feeling very anxious in my life. I have exams coming up. I have to pay off student loans. I am one of the only Asian people in my program, and I'm feeling, a little bit disconnected, a little bit isolated. So I decide to go for therapy. I decide to see the counselor at my school. And they suggest to me a breathing exercise that they say is really going to help me. And they say, you should also check out this app. I really recommend this app. It's going to be really helpful for you. So it appeared that seems like a very benign suggestion. It seems very helpful, actually, but there is a greater impact that goes beyond, that goes under the surface if we take a look. So let's think about, what is this impact of these suggestions? The first one is that I may not know this, but the strategy that I was just taught and the app that I was just referred to is actually based on hundreds of years of wisdom of my own tradition. I may end up paying for this app while my ancestors have passed this wisdom down through the generations for free. I may start to believe an implicit message that what I'm learning in the session is more valuable or more scientific than what I have at home. I might feel more disconnected from my own identity because I'm not having a space to be able to talk about that in therapy. I'm not getting to talk about my culture or heritage or parts of me that exist, that I know are there, but I can't really access them, and I'm not sure how. I need a little bit of guidance, and I've been looking for that. I may also start to feel more shame around my heritage. As I start to believe the narrative that my culture does not believe in mental health. My family doesn't talk about mental health. They're kind of backwards. My culture's a little archaic. We all need to modernize. Everybody needs to go to therapy. And so this story can apply to people of all different backgrounds, Asian backgrounds and other, and including people who identify as Muslim, whose history and traditions of meditation and of contributions to science have been erased, and whose religion, especially right now, is portrayed by the media as being barbaric and backwards. And people start to believe that. Younger generations start to internalize these messages. And what's really happening, in this scenario is that I just described, is that my culture has been repackaged and sold to me as something new and better. My family has a hard time talking about this because, as Uma described, the language of holism doesn't separate the mind from the body from the spirit. So when you're talking about just mental disorders or mental illness, the language or the conceptualization isn't even there within Asian cultures. And I also wanted to point out, with vet med students and people, the One Health approach. Even that is holistic in the sense that the health of animals and people are interconnected. You can't talk about that as being separate. They affect each other. It's an ecosystem. The other part of what's happening in our families and our cultures and generations is, as Uma and Urmi described, there's so much history of pain and trauma from colonization, from displacement, from forced migration, from oppression, from discrimination, that if we start talking about those things, sometimes it can feel really overwhelming, and there's just too much pain. Our families can't go there sometimes. It's too hard to have to start unpacking all of that. And for some parents, you know, not all, but for some parents, when they hear that their children are suffering, they feel depressed or anxious. They start to feel that, you know, what have I done wrong? I've worked so hard for my family, and now my kids are suffering. Did I fail? Did I do something wrong? And of course, you know, it's inevitable that we all suffer, and in their belief system, they probably believe that too. But as parents or grandparents, it may feel like they've worked very hard and they wanted to protect their kids or their future generations. And that's impossible in some ways. New world, new problems. That's how it goes. So if we go to the next slide. These were some of the questions from all of you that were posed to us. And I think the first one that we may have covered already. How does that impact us? You know, Asian communities have been built with the value of collectivism, whether that's within families, in larger communities, spiritual or religious communities. And with the history of colonization and neocolonialism, the feeling of fragmentation, of separation, of loss, of something that's an ache or something that's missing, is an impact. What's the best way to discuss topics like this with my friends? That was a great question. And one of the things that we came up with, and you know, anybody else can jump in here, or you can add some things in the chat if you have any additional ideas of what's the best way to discuss, would be to label or name this dissonance, this shame, or these feelings in the body that feel like things are not quite aligning. To read articles such as this one together and discuss what you resonate with. To share traditional healing practice from your own families and your own cultures with each other. To talk about your ancestry and the first ancestor that came to this country, and ask them, you know, internally, what did you give up to be here? To talk about experiences of anti-Asian racism as nuanced. These are sometimes difficult to talk about. Sometimes it's because of the model minority myth that Uma mentioned. It feels like we don't need to talk about this as much. You know, maybe we're making a big deal out of things. We just need to push forward rather than acknowledge the microaggressions, the racism, that the lack of representation or safe spaces that we may be facing. And how do I tell my therapist I'd like them to engage in this sort of framework or shift? So this is hard because some therapists will be willing to take a look at, you know, learning more and expanding what they already know. And they can do so through their own education, through post-colonial theory, liberation psychology, queer theory, anti-oppressive theory. You can tell them, I'd like somebody, I'd like to work within these frameworks. You can find somebody who says they specialize in these frameworks. And you can ask, I need to talk more about my identity. I need to talk more about my culture or my beliefs. And there may be times when your therapist may not know how to do this. And if they are self-aware, they will try to refer you. Uma and Urmi, is there anything else that I missed or that we should be, that could be included? Anybody else in the chat?
Yeah, please feel free to post in the chat. I just wanted to expand on the model minority myth and the perpetual outsider too, is that when there's so much pressure to be the model minority in society, that it does suppress the upset and experience of racism. It doesn't allow us to engage with that process and to, so it's very, how would I describe it? It's very systemically enforced for us to not discuss these topics that are hard and related to systemic issues or the history of oppression in our communities, because we have this expectation of performing or being that model minority, right? I'm happy to explain that more if you need to, but I don't know if anyone else had thoughts, or please feel free to share your thoughts in the chat box as well. We'll also have an opportunity in discussion. Aliya, do you think we should move on? For me?
Yes, yes. We were going to break out into small groups. We can still do that, or we can talk as a larger group, but depending on what people feel comfortable with. We were going to, but we can just go over some of the guidelines, and this is when we're going to stop recording so that people can share a little bit more freely. And we would introduce ourselves and our ethnicity and agree that what is talked about in group stays in group. So a respect for being able to be vulnerable, to share, and a respect for privacy. And sometimes we do need to process outside of group. And if that's the case, you know, outside of this session, and it's great to talk about these things with each other. And so in doing so, just not to share from your own experience rather than what other people have said, or not identify the person that you're talking about. And being able to do that in a safe and secure place with other people. And when we do share, doing so from our own experience, because everybody's experiences are so different and everyone's coming from different backgrounds. And, you know, being conscious sometimes of the intent of where you're coming from. And sometimes it helps to just state your intent when you're not sure how it's going to impact the rest of the group or other people, and you're not quite sure of if you feel like you might offend somebody, or you're not quite sure how it's going to land. You can always just state your intent. Some of these conversations are going to be just uncomfortable because, like other people mentioned in the chat, we're unlearning things. We are, you know, working through our own experiences of liberation, and that is very uncomfortable. There's so many things to have to unpack and unlearn. And if we are going to break out into groups, having a note taker so that we can all come back and share at the end. So do we want to stop recording now?